Fei Er Wan, commonly translated as fat child pill, is a classical traditional Chinese medicine formula in the category reduce food accumulation and clear heat. Its core action is to reduce food stagnation, clears heat, and supports pediatric digestive function in the traditional framework. The pattern framework is childhood food accumulation with spleen weakness and possible parasites in classical use. This mini-lecture focuses on the formula logic, recognizable pattern features, and practical drug-herb interaction screening. It is an educational overview, not an instruction to self-prescribe. Start with the pattern rather than the disease label. The traditional target pattern is childhood food accumulation with spleen weakness and possible parasites in classical use. Typical clues include poor appetite, abdominal distension, loose stool, weight or growth concerns, irritability, greasy coat. These findings are not all required, and the same biomedical diagnosis can present with different Chinese medicine patterns. Conversely, these traditional signs can arise from multiple biomedical conditions. That is why pattern differentiation and conventional red flag screening should occur together. Key herbs commonly associated with this formula include Sheng, Huang Lion, Ruduku, Shijunzai, Maya, Mujiang, Bing Lang. In classical formula analysis, some herbs address the principal mechanism, others support the chief action, and others harmonize or direct the prescription. The exact composition can vary by lineage, manufacturer, granule concentration, and modification. For interaction analysis, the actual ingredient label and dose are more important than relying only on the traditional formula name. The first interaction focuses pharmacokinetic uncertainty and medication review. For many multi-herb formulas, high-quality human interaction data are limited. Laboratory findings on cytochrome P450 enzymes or transporters do not always translate directly into a clinical effect. The correct response to uncertainty is not to assume zero interaction. It is to review the complete medication list, use reputable products, avoid unnecessary polypharmacy, and monitor clinical endpoints that matter. In practice, ask what prescription drugs, over-the-counter products, supplements, alcohol, caffeine, and other herbal formulas the person uses. A multi-herb product can create several overlapping mechanisms at once, so medication reconciliation is a core safety step. The second interaction focuses pharmacokinetic uncertainty and medication review. For many multi-herb formulas, high-quality human interaction data are limited. Laboratory findings on cytochrome P450 enzymes or transporters do not always translate directly into a clinical effect. The correct response to uncertainty is not to assume zero interaction. It is to review the complete medication list, use reputable products, avoid unnecessary polypharmacy, and monitor clinical endpoints that matter. The quality of evidence for herb-drug interactions ranges from pharmacology and case reports to controlled human data, and that evidence is uneven. Therefore, distinguish a proven contraindication from a plausible additive effect, and use monitoring where the uncertainty is clinically meaningful. Safety summary. Use the formula only after pattern differentiation and medication review. Persistent, severe, or unexplained symptoms require appropriate biomedical assessment. Also verify species identity, processing method, contamination testing, and manufacturer quality. Stop and seek appropriate care for severe or rapidly worsening symptoms, allergic reactions, fainting, chest pain, major bleeding, neurologic deficits, or other red flags. Pregnancy, breastfeeding, significant kidney or liver disease, and polypharmacy warrant a lower threshold for professional review. A useful clinical checklist has 5 steps. 1. Confirm the traditional pattern. 2. Identify the exact product and full ingredient list. 3. Reconcile prescriptions, over-the-counter drugs, supplements, and other herbs. 4. Identify measurable endpoints, such as blood pressure, glucose, inner, electrolytes, symptoms, or bowel function when relevant. 5. Reassess after starting, stopping, or changing the formula rather than assuming the response will be stable. In summary, Fei Er Wan is best understood as a pattern-based prescription whose action is to reduce food stagnation, clears heat, and supports pediatric digestive function in the traditional framework. The key safety principle is targeted interaction screening plus objective monitoring when risk is plausible. Standard references for further study include Chinese herbal medicine formulas and strategies by Bensky and colleagues, Chinese medical herbology and pharmacology by Chen and Current drug interaction and pharmacology references.